I'm André Tomlin from the Mental Health, and this is a conversation that's been a few years in the making. Professor Chris Hollis and Professor Ellen Townsend have led the Digital Youth Programme, one of the most ambitious research initiatives exploring how digital tools can support young people's mental health. Thankfully, they've refused to take sides in the screens are good, screens are bad debate. Instead, they've done something much harder. They've actually tried to understand what's really going on. At a time when youth mental health is in crisis and NHS services are overwhelmed, their work on everything from socially assistive robots to implementation pathways might just show us a way forward. Let's dive in.
We've known for some time that adolescent mental health has been deteriorating from large nationally collected survey data. And at the same time, there have been difficulties with accessing support for those problems. We don't exactly know why that increase has happened. It's happened at the same time as young people reporting quite high levels of loneliness, for example. And so we have this situation where there's a real gap between need and what services can provide. And so digital felt like an obvious place where we might be able to help fill that gap. And I think our goal was to understand how we can develop digital tools and supports for young people in this space, given that they are now so, living in that space anyway, so to meet them where they are.
While others were still debating whether digital was the problem or the solution, Chris and Ellen were already building a research programme to find out. And what they discovered challenges a lot of the simplistic thinking out there.
It's very important to understand both the opportunities and the risks of digital interventions, but also the wider digital environment. And I think what our programme has done, I think really well, is bring those two sides together. Without having any preconceived ideas, in terms of what the answers are going to be, and then bring young people right into the centre of that, both in terms of developing our tools and understanding risks. I think we've learnt that we need to move away from really sort of simplistic formulations, ideas like it's just screen time or it's just exposure, and that there will be simple solutions.
The idea that you have to look at both sides of the equation has been something that's been missing in the field, that we have, there's a dearth of theoretical kind of postulation about what might be going on. So I think that's been quite powerful to understand both the risks and the kind of benefits. The co-production side of things has been incredibly powerful. And the way the young people have helped us to interpret that is that it's a caring. It's not just a nice to have. It's just a very central part of what a research endeavour with young people should look like these days. And yes, we do have these kind of tangible outputs. So we have a socially assistive robot, which actually really does seem to help young people manage emotion regulation and decrease depression and so on. So we have tools that are almost ready to go now to support young people in lots of different ways.
So they've developed real tools that can help young people with emotion regulation. But getting research into practice, that's where it gets messy. Chris and Ellen have been pioneering something quite new, bridging the gap between academic research and commercial reality. And the cultures couldn't be more different.
And MindTech itself has kind of moved forward in doing that. MindTech Bridge, which is our initiative really to bring evidence-based research coming out of digital youth interventions to become really tractable products and commercial products, because ultimately we want young people to benefit and use the great research that we're undertaking.
Chris and Ellen have put young people at the absolute centre of this work. Through Sprouting Minds, their youth panel, young people aren't research subjects. They're genuine collaborators, co-producing research and challenging assumptions. As Chris said, colleagues who were sceptical found their entire approach transformed by working alongside these young people. There were real breakthroughs in this programme of work, important findings about the risks and benefits of screens and social media. Purrble, the assistive robot, Sparx-UK, a CBT-based game, and CATSAP, helping to understand and support young people who self-harm. Partnerships between academia and industry that actually work. The lessons go beyond specific tools or studies. It's about relationships, honest confrontation of complexity, and actually working alongside the people these interventions are meant to serve.